Look at Mr. Post Malone. Doesn't he look better without tattoos? So I was playing Magic the Gathering with a friend the other day who suggested that I should do a Taylor Swift reaction video. And we were listening to her new album in the background, so I didn't actually get to give it my undivided attention, but it sounded really good. And one of the songs seems to have strong themes in relationships and attachments, as most of as most of Taylor Swift's songs do. They are often about breakups and relationships. But there's a lot to reflect on when we talk about attachment styles and breakups and heartache and how we move on from things. So I'm excited to listen to this song. I have not heard it before, but let's see if there's any mental health reflections, psychiatric reflections to make. If you're new here, hello and a warm welcome. My name is Dr. Sil. I'm a junior doctor from Australia training to become a psychiatrist. And in my free time, I make mental health education videos and sometimes I react to music and other content. If that sounds like your cup of tea, consider subscribing. Let's get into it.
I was supposed to be sent away, but they forgot to come and get me. I was a functioning alcoholic till nobody noticed my new aesthetic.
So already what we can see is the common use of the anti-gravity gun that's used in mental health settings, of course. You shoot the bed and it floats into the wall. This is a common form of mental health treatment. That's obviously a joke. But I love the black and white aesthetic. And I feel like there's like devil horns in her dress. It's giving off a pretty eerie vibe already. I think it's interesting to note that everything seems slanted to the right. It's kind of like a distorted perspective. And she's talking about being a functioning alcoholic. And I wonder if that's kind of what it's like to be in a chronic state of kind of drunk, functional state where everything just feels always distorted. But, you got to remember people who have chronic drinking or alcohol use disorder, often they're trying to treat something. It's their way of finding a medicine or a defense mechanism to some kind of stress, to some kind of stressor. And often it's a grief or a trauma, or maybe it's a manifestation of some sign of neglect back in childhood, and it's not a healthy way to go, but it's the best they can do. And it's really hard to go and seek help for alcohol use disorder, but there is a lot of hope. If someone wants to stop drinking, there's a lot that can be done to help that. There's lots of medicines and lots of support out there with good evidence. But if someone doesn't want to stop drinking, there's very little you can do. It has to be generated from the individual. They have to want to stop in order to stop. And alcohol use is, especially alcohol dependence is life-threatening. I've seen people come into hospital and get delirium tremens from withdrawals. So if you ever get the shakes in the morning, or someone gets the shakes in the morning, that's a very bad sign. That's a sign of dependence, and it can get worse and worse, and it become anxiety, and then it can become kind of the next stage from anxiety is like a kind of psychosis and a kind of delirium, and people can die from that and get into seizures, and you can get status epilepticus. And so alcohol withdrawal is a very serious thing. Maybe you are a functioning alcoholic or someone you know is a functioning alcoholic, but alcohol is dangerous. Yeah, and I don't mind a drink every now and then, but I definitely don't do like a regular everyday glass of wine kind of thing or bottle of wine kind of thing. I just think the risks outweigh the benefits. Oh my gosh, look what I just noticed. I have not subscribed to Taylor Swift's channel. Boom! There we go. Subscribe, notifications on. I want to listen to all the new songs. If you guys have not subscribed to me, please consider subscribing like I have to Taylor Swift and leaving the video a like. That's how you help the algorithm. That's how YouTube helps us little channels. Let's keep going.
All of this to say, I hope you're okay, but you're the reason. And no.
Just so everyone knows, if someone does need mechanical restraints in psychiatric hospitals or mental health wards or whatever, we don't use metal lock and chain, and it's very rarely done. The whole movement in mental health is away from mechanical restraints, and if it is done, it is not sustained for very long. It's always sustained for the minimum amount of time. So if someone is restrained. They need like constant observation, and usually they get placed into a seclusion area where they can de-escalate. And if they are in a seclusion area, which means they're locked against their will in a place for their safety, right? It's never done as punishment or as a way to without very good cause. But if someone is in seclusion, they will have one-to-one nursing line of sight, and they will have a doctor review every couple of hours as per the local healthcare protocol to decide whether seclusion is to be continued. So you review the patient, you talk to the patient, you see if they're ready to come out. And then from seclusion, they can go into their own de-escalation area, which is, quite a large area with an outdoor area and bathrooms, and it's like a mini ward just for one person to kind of let the agitation settle. But again, this is last resort stuff. We do not do this willy-nilly. It is not it's actually quite hard to get to that level. You have to be very unwell. But anyway, just to comment that there's no chains and there's no handcuffs or anything like that. But you can use like Velcro straps in absolute emergency. I mean, I've done I don't know how many 6-month rotations I've done in mental health, probably around 1, 2, 3, 4, 5, 6. So I've done about six-month rotations throughout my time as a doctor in psychiatric facilities, and I've probably only seen mechanical restraints a handful of times, so it's quite uncommon.
One here's to blame, but what about your quiet treason? And for a fortnight there we were, forever running to you. Sometimes ask about the weather, now you're in my backyard, turned into good neighbors. Your wife waters flowers, I wanna kill her.
Listen, I was not expecting to have so much commenting to make in a Taylor Swift song. But this is actually, I've been pausing it heaps. Sorry about that. But just got to give a shout out to good editing. I never knew how to video edit before starting my own YouTube channel, but I thought I would learn, and I've been doing it myself for years. I finally have, I've used a couple of editors, and now I have someone who helps out. Shout out Krista, my video editor, who's going to edit this video as well. She's great. But I can appreciate when video editing is good, and that was good video editing. Interesting to have these tattoos. Stay away, always tired. Chronic fatigue. That's a common issue in mental health videos. If you guys want a video about chronic fatigue, leave a comment down below. I don't know what DDP is about, but let me know in the comments if you know what DDP stands for. Now, the last thing to say about that verse is she does talk about how, we were in a relationship for a fortnight, and now you're with your wife and you're a neighbor, and she's watering flowers and I want to kill her. We do often have to ask our patients about homicidal or suicidal ideation as psychiatry doctors, but it's important to appreciate that thoughts and actions are very different things, and you're allowed to have thoughts of homicide and suicide, and the question is, that's taken into account in someone's risk profile for sure. If someone's really thinking about killing someone, then that's fine. But if it's like said superficially because someone's angry but they've never been violent to anyone else before, and the person's able to say that they wouldn't actually do it, but it's just how they feel at the moment and they're able to regulate their emotions, that's very different to someone who's saying, I want to kill that person, but has had a history of multiple homicides and uncontrolled psychosis, where they have problems reality testing what's real, what's not real, and they have command hallucinations telling them to kill someone, whilst having passivity phenomena where they feel an alien agent is controlling their body and moving them to fulfill the demands of this external auditory hallucination they're having. Those are two very different profiles, but the point is you can definitely have thoughts of wanting to hurt someone or kill someone or hurt yourself, and that's okay it's okay to have them. It's important to talk about them, but the key thing is understanding why they're there and what we're going to do to improve them, because obviously it's miserable to have these kind of chronic feelings of either anger towards others or anger towards yourself. You've got to remember, that depression is a heterogeneous disorder. There's lots of different types of depression, but some depressions are anger turned inwards, and kind of exploring childhood and relationships and all that kind of stuff can show why you're getting these different symptoms.
my mornings are Mondays stuck in an endless February. I took the miracle move on drug. The effects were temporary. And I love you. It's ruining my life. I touched you for only a fortnight. But I touched you, and for a
Oh, that was really nice. First of all, I love Post Malone. I actually haven't listened to that much of his music, but I love watching him play Magic the Gathering. He's like one of the. I think he brought a lot of attention to the game. And that's how I kind of discovered it as well, watching him play on YouTube, and yeah, it got me hooked. Interesting that it's the black and white kind of video clip, but the only thing that was of color was the, I guess, representation of their love and touching. And I guess another thing to comment on is these brief but very profound love affairs. I think the key thing some of the key points I want to make about these brief and very intense love affairs is that you really can't know someone in 2 weeks. What you can do is form what you internally think they are and fall in love with that. So person A and person B fall in love, have an incredible 2 weeks, and it's just fireworks, and they say I want to be together forever. Well, first of all, you know very little about a person in 2 weeks, but what you do have is an internal generated a perspective of what they are. So you've kind of almost projected who they are onto them. And that's going to cause problems down the line because you're going to essentially be disappointed when they don't fulfill your model of who they are. A much healthier way to go about it, is to enjoy it. Every relationship often has that start, that fiery start, and as reality sinks in, the relationship either finds a new kind of mature type of love or settles. But it's just important to try and not project your views of someone onto them and let them especially like this. You see this in kids as well, where parents project their wants onto a kid as opposed to letting the kid kind of explore their own curiosities. And I don't know what's right. I don't have kids. Don't listen to me. But it's important to just like be genuinely curious and let someone slowly form their impression on you, and to not try and merge your perspective of them onto them. Is that making any sense? I guess the key takeaway I'm trying to say is if you were wildly in love with someone for 2 weeks, that doesn't, and then you break up or you leave, what you're going to think about and romanticize about them is not reality. That's the key point I want to make. You're going to think they're amazing and perfect and that you last forever together, and that those little imperfections were nothing and you can forget about them because the good things were so good. But that's not reality. And I really like Alain de Botton from the School of Life and the points he makes around unromanticizing love, essentially being more realistic about relationships, because it's a big problem that relationships are much shorter lived and unsustainable these days because people have these romantic, unrealistic expectations. Let's keep going.
fortnight there we were, forever running to you. Sometimes ask about the weather. Now you're in my backyard, turned into good neighbors. Your wife waters flowers. I wanna kill her. And for a fortnight there we were, together running to you. Sometimes comment on my sweater. Now you
I just want to go back. Hang on. Look at Mr. Post Malone. Doesn't he look better without tattoos? No offense.
comment on my sweater. Now you're at the mailbox, turned into good neighbors. My husband is cheating. I wanna kill him. I love you. It's ruining my life. It's ruining my life.
Is that Ethan Hawke? Oh my gosh. I'm trying to remember who Ethan Hawke is. Hang on. Yeah. Oh, called it. Gosh, they must have big budgets for these music clips. I mean, it's gotten 43 million views in a week. That's like more than my entire channel multiple times over. Anyway, I just wanted to comment on a couple of things. So she's obviously got some weird contraption which is monitoring her brainwaves, and you saw those kind of squiggly things before. Just to be very clear, and obviously this is an artistic rendition, if someone is to get the two things this could kind of look like is EEG, which is an electroencephalogram, or ECT, which is electroconvulsive therapy, neither of which are like this. So EEGs, which is probably what this thing most closely represents, this thing. These are when you put electrodes on someone's scalp and you are monitoring essentially the activity in the neurons underneath the scalp where those electrodes are. So it's between electrodes. So this would be the potential between electrodes and this and this and this. If you want to do a full EEG, it is, there's heaps. It's a very complicated piece of paper with much more than just 4 lines. A very simple one is just to put 2 on the frontal or temporal areas. No, it's just frontal or just above the lateral canthus of the eye. So just there, you put 2 dots there, and then the other 2 dots go behind the ears on the mastoid process, on the bony protuberance behind the ear. And you want to put it on a bony area because that's where electricity will conduct better through, as opposed to like a fat pad or soft tissue, because electricity doesn't conduct through that well. And you look at the waveforms between them, and what it can tell you is if someone's having a seizure or not, or if there's any abnormal discharges. It can also tell you what state of consciousness they're in. But when we do something like ECT, which is done in a much nicer environment than this, and is often people often consent to it because it's a life-saving procedure. It does have side effects, but if someone has like a very dangerous depression, psychosis or mania, it can be a life-saving procedure. So ECT has a lot of stigma with it, but it's life-saving. That's all I want. I have a video about it if you want to learn more about it. Anyway. In ECT, we have to use EEGs, electroencephalograms, in order to monitor what state a person is, because the person has a general anesthetic. So you can't always see them seizing, you can't see what state the brain is in. So using the EEG, you can see what state the brain is in, and which allows us to use a muscle relaxant, so that instead of when someone's seizing, they're not like shaking around. They just sometimes you'll see a little like twitch because the muscle relaxant won't be maximum dose, and that's actually quite helpful. We use that to compare what we see on the EEG to what we see on the person. And this tool here doesn't exist. And that's okay, it's art. This start and end gives me Fallout vibes. I don't know who Josh Charles is, but that's cool. They got Ethan Hawke to feature. Oh, sorry, I'm just going through the comments because I always find comments interesting in these YouTube videos. The tattoos she's got are Post Malone's. And that's kind of how he's rubbed off on her. I didn't realize those were the ones he had. That's super interesting. Well, there you have it, a Swifty video. I hope you enjoyed it. That was really fun to film and to watch. And if you have any other music videos you want me to react to, put them in the comments down below. I am trying to hit 100k subscribers by the time I'm 30, which is in 2 months. So if you want to support me on that journey, please consider subscribing to the channel. Other than that, I wish you all a beautiful day. That was interesting to reflect on ECT and restraints and seclusion and relationships and alcoholism. Yeah, that brings up a lot. Yeah, I find it funny that I can watch a video clip about just about anything and end up ranting about mental health topics. I guess that just shows how tangential my brain is. But thank you for staying till the end, and I just wish you a beautiful day full of love. Call a friend, tell them you love them, and I will see you in the next video. All right, bye for now.